Hey, we're going to do E-Stim today. I'm Adam, and this is Jennifer. But before we do it, she is going to tell you some things about it.
For contraindications, you're going to have pacemaker, pregnancy, arrhythmias, carotid, sinus, overrecent, and non-union fractures. For precautions, you're going to have cardiac disease, poor sensation, mental impairments, malignancy, seizures, and extensive torn tissues.
Alright, so once you get ready to do it, the first thing you want to do is inspect the modality for any kind of safety hazards. We've already done that, it's good to go. But you want to talk about how often that you're going to do the maintenance on it. Everything's good on that. You'll introduce yourself to the patient. I already know Jennifer, but hey. You're going to make sure the patient is positioned correctly. I'm going to be doing this on her shin, so just as long as I've got her leg, especially lower leg, relaxed, so the position's good, she can be sitting up, laying down, whatever. Anyway, we want to make sure we have all our supplies. Since it's on the leg, I'm using these bigger pads. And I've got alcohol pads here, some homemade alcohol pads that I just made myself. Just cleaning her leg off before we do the treatment.
It's really cold.
And it's really cold. Alright. Anyway, we're doing E-Stim high volt. High volt is a Twin Peaks version of E-Stim. You would do high volt for wound and edema management, muscle re-education, if you have muscle spasms you could do it, or pain modulation. She's pretty healthy, but I'm going to do it on her anyway. Alright, so with high volt, it's a little different than the rest of the E-Stims if you're studying those, because it does have a negative polarity, which means the black lead, which is negative, will go distal to the treatment area. So anyway, I got that all done. So I just hit electrotherapy on the machine. I'm gonna hit high volt and edit it a little bit, make sure the polarity is negative. I'm gonna set the frequency to 120 pulses per second. Have it on continuous sweep and a continuous cycle time. Alrighty, and then I'm gonna turn the volts up until, first of all, I'm just gonna ask her to let me know when she can feel it. So, alright, so now that she's starting to feel it, I'm going to turn it up a little more, and I just want her to tell me when it starts getting a little bit uncomfortable, but it's not quite painful yet. Alright, that's on 130 volts. I'm going to hit start, and that'll start the treatment. Treatment time is 20 minutes. Everybody's number will be different, just different tolerance for it. Anyway, she'll sit there like that for 20 minutes. Constant communication with the patient while the treatment's going on. And also when it's over, check for any irritations, burns, or allergic reactions. Alright, once you get to the end of the treatment time, 20 minutes, it'll automatically stop, and I'm going to hit stop, so we're not quite there yet, and get it back to the home screen. Then you're going take the pads off, never pull by the cord. Stick them on my own side. These say on and no, they're pretty nifty.
Are you recording?
Alright. And like I said earlier, you're going to check for any burns, allergic reactions, or skin irritations. She looks good. Good to go. Alright, well that is the stem. I vote.